then I'm going to count you in 10, 9, 8, 7, 6, 5. I'm going to start now.
Hello everybody and welcome to the Secrets of IVF Success with City Fertility. I hope you've all had a wonderful day and are continuing to have a great evening. Thank you all so much for being here and for joining in to help us share some of these amazing stories that we have within our clinic. So the way tonight's going to go is we're going to have a question section with our wonderful patients Barbara and Igor. They will say hello in a second. And then we also have our absolutely wonderful fertility specialist, Dr. Malini Uppal, with us today to share some of her invaluable knowledge. So Barbara and Igor, would you like to introduce yourself?
Yes, I'm Barbara, and I'm a scientist.
Lovely.
I'm Igor. I'm also a scientist. We met through science, Barbara and I, and we're hopefully here to tell you a bit about our story with IVF and the ups and downs and such.
Yes.
Yeah, brilliant. And we're so thankful that you have come here to do that and kind of share something so personal. We really do appreciate that. For any of our viewers, if you want to submit any questions throughout this, please do put them into the chat box. I am keeping an eye. Also, we will be sharing some very useful links in the chat box as well that you can visit throughout or afterwards, and you will be able to revisit this webinar on YouTube after today. So, Dr. Malini Uppal, how are you?
I'm good, very well, thank you, Ella. How are you?
Good, thank you. I'm great, thank you. Would you like to say a little bit about yourself?
Hello, everyone. Hello, and thank you for attending this webinar. I'm very grateful to Barbara and Igor to spare some time to share their journey and give us some kind of, a feedback on how we have done with them, which we don't get to hear very often, I must say. So I'm Dr. Malini Uppal, Medical Director at Gannett City Fertility, based in Farringdon, Central London. I am also the person responsible for HFEA, and I am looking forward to spending this evening with you all. Thank you.
Lovely, thank you. So, Barbara and Igor, so can you describe your IVF journey for us, please?
Yes, I can start. So we started our IVF journey in our late 30s. Initially, I had been told that everything was fine. Initially, I was told that I had lots of eggs and everything was fine. But then when we started trying, things were not happening. So after more than a year, we ended up going to an IVF clinic to test what was happening. And then it was clear that the numbers were really off. I can hear myself.
The egg reserve was low.
Yeah,
as it turned out.
So we ended up doing many tests and doing. We were back in the US at the time, and over there you have to do IUI, which is intrauterine insemination. We did a few cycles, but nothing worked. But in the end, finally IVF worked. But it was, my egg count was very, very low, and my numbers were really low. So yeah.
It was several cycles of IVF, one miscarriage. It wasn't a straightforward journey at all, and it's difficult. But obviously, what you get at the end is priceless.
Yes.
Yeah, of course. It must have been a bit of a shock to hear that your egg reserve was kind of on the low side.
Yes, it was. I mean, no one in my family had any fertility issues, but then they had the children younger, and I never imagined that would happen.
Yeah.
So it was a shock. I think that the good thing is that the egg quality was good, but still, as Igor mentioned, we had our first IVF that was not canceled because we had a few canceled because of lack of eggs. And then finally we had 3 eggs, 3 embryos. So 3 embryos that were fertilized, and then I had a miscarriage after that, which was devastating. And then I had another 3 embryos, and then we had twins, and we lost 1 twin in the after the heartbeat, which was also devastating. It was very hard, but we kept going. We kept going, and we had a healthy baby. But we had lost that twin as well. So
Yeah.
And this is only half of the story, because that's what while we were still living in America. Then when we moved to the UK, we wanted to have a second child, and of course we still were facing the same issue with fertility, and we started going through various clinics in London. And let me tell you, it really makes a huge difference where you go. And it's not just because the clinical team might be better trained, or it's just it makes a difference because the the people that see you, all the nurses, the doctors, even the finance team, everybody was just fantastic at City Fertility. And that is helpful because you're going through a very, very emotional, rough time. And you need that type of sympathy and that type of, bedside manner in order for you to feel confident that this could work. And as I said, we went to multiple places before we got to City Fertility, and we can tell you that we didn't feel that way in other places, which is why we kept looking and going to different places. But we're so happy that we ended up where we did.
I mean, most clinics with what would happen, is that they would see my numbers, and first of all, they would take it as a commercial thing, sort of like, oh, we give you how many cycles for X amount of money, and it didn't really make any sense, and all the tests were so expensive. And also, one of the other clinics, which I will not mention any names, basically did not even return my calls or want me as a patient because of the numbers being very, very low. So yeah, I mean, once we did that cycle in the Czech Republic, and this is how we got to know the existence of City Fertility, because we did the ultrasounds, the scans over there in your clinic, and this is when it didn't work in the Czech Republic. It didn't work because I had only 1 egg, and then we said, why don't we? We looked up the clinic. We really liked the bedside manners of everyone there, so we decided, why don't we give it a try here? And then, the rest is, then we joined the clinic. And again, as Igor said, everything from the people attending, answering the door, from everything. I mean, it was so important after such a difficult journey to feel at home in the clinic, because you really need to feel that the people who have your best interest at heart, right? So we really felt this way.
Yeah.
One of the things. Sorry, I was just going to say that, as Barbara said, one of the things that really turned us off with one of the other clinics was the fact that they see you as a statistic, and if you're a challenging case, they're going to say you're going to ruin our numbers, because there's a better chance of you not getting pregnant than there is a chance, and therefore we're just not going to gamble it, and we won't take you as a patient, which did not happen here at all. And the other thing that I forgot to mention is that the doctors at City Fertility were very receptive to everything we were saying, because we had done this a lot already, many cycles, and we had done our reading. we are scientists, so we understand the scientific basis of why certain things are done. Although we are not, you know, clinicians, we do understand what is being done to some extent. And you know, the clinical team was very mindful of that and very receptive to that, and they didn't dismiss our, you know, questions or concerns. And we know that that's not just with us who are scientists, but with everybody, you know, taking the time to go through things with the patient, explaining why certain things would work or not work in a specific case it really goes a long way. You know, it makes you it makes you feel in good hands, really.
Yeah, that's so heartwarming to hear that you've had these experiences with us. Thank you. So I've just kind of picked up in that we've kind of mentioned a lot about the emotional side of fertility and IVF treatment. Can you guys speak to how important emotional support is during IVF and fertility journeys?
Yeah, sure. I mean, I think that it's very important. I think when I did this back in New York, I was already going to counseling, so it really helped me because, you know, especially when I lost a baby and then I lost a twin, you know, counseling is very important, and, you know, also to learn about having resilience, right? To be able to recover from things. I know that City Fertility was offering counseling as you know, as part of the treatment, and I think it's very important. When we did it, in the end, we didn't take it because we had already, you know, built a really strong kind of like base for this. But I think it's very important because it's a challenging moment, and also you're only not playing with your mind but also with your body, right? Because for women,
Yeah.
we, you know, you're injecting all these things, and it's you know, it's very, it's difficult, right? So you need this support. So.
Yeah, definitely.
And if I can add, you know, from my perspective, it is also important because you know, obviously you are sharing this difficult time with your partner, and you're suffering not physically but emotionally in to the same extent that they are, and sometimes because they also have to endure the physical aspects of this, then you have to be willing to take on just a little bit more of the emotional weight. And without the counseling, that could become, you know, something very, very difficult to do. And so you also are, you know, you become grateful that your partner has decided to, you know, get some additional support from counseling, because that helps you as well. So I think it's important. And of course, you know, everyone's different. People cope in different ways. Some people are more resilient than others. And so every person is going to be different. But in our case, I think it was helpful for sure.
Yeah, and thank you for mentioning there, Igor, about support for partners as well. Obviously, there is a typical or tendency to focus perhaps on one party, usually the person receiving the treatment. But I think it's really important to remember that you're going through this as a couple, and that will create both personal and relationship stresses. And that's kind of, it's important to acknowledge what's out there to support for all those circumstances. Dr. Malini, could you speak a little bit about how important it is to emotionally support our patients?
I think emotional support is one of the very, very important aspect of IVF treatment, and not only going through a IVF, or any kind of fertility journey that a patient goes through, because it is very difficult, first of all, for the patients, for anyone to accept that, you know, they're not naturally getting pregnant or not naturally able to get a child, and they need some help. And on top of that, when they go through this journey, there's so much, as rightly Barbara was just mentioning, when it is the woman part which becomes more obvious, you know, in terms of that they're going through the injection, they're going through the medication, or going through the miscarriages, or even that little 2 weeks wait period when you're waiting for that pregnancy test after doing everything, after having the 1 or 2 eggs and after having the embryo transfer, those 2 weeks period, it's such an anxious time, and it's such a time where you need the support. And if you do not get that support at that time, and I must say, partners or male or female partner for any couples who are going through treatment, they're somewhere kept at the back step. They're not thought of that much as compared to the actual patient who's going through, but they are equally suffering from this, are equally having the same emotional stress, because they are in the journey together with their partners. So supporting the couple emotionally is very, very essential for them to go through this journey, because it's not about what the end result is going to be. It could be positive or negative, but somewhere for them to know that there is enough support, we are there. If it is, and there is something that we can do about it, for them to realize that, well, whatever the outcome is, we are here to support you, is very, very important.
Yeah, definitely. And then I think it's come up a couple of times about kind of the shock and the kind of almost emotional trauma of finding out that you are struggling to conceive. I'm going to open this question to everybody here. Do we think that having gone through IVF or having regularly be treating patients with fertility problems, do we feel that the general public should be provided more education on fertility, perhaps in schools or as part of like a public health campaign?
Is that me to answer?
Was one for everybody?
Done for everybody. I mean, I am a very, very strong believer in this, that we are not educating our youngsters enough. It should be an essential part of high school, and I know that children do get some sort of education in the high school, but that's obviously not enough, because it should be a part of every college, university routine, any course that the youngster joins. Because sometimes what happens is, without realizing, and now that, as we know, Barbara is and Egor, they are scientists, there's so much of education, so much of things, ambition that we want to do for ourselves. Not starting a family might not be at the priority, when we are younger. However, just having that information and having a knowledge about yourself is very important. There are women now who decide that they do not want children, even after, as long as they have the information and they make an informed decision. This is what I decide today. I want to postpone it, and I have option of freezing eggs or freezing embryos, and then we have a very good likelihood later on, whenever we are ready to have a family, just to have that knowledge, that option, that choice, that information is very, very important. So I think, yes, we should be educating our youngsters, our younger generation, a lot more than what we have at the moment currently.
Yeah, thank you. Barbara and Igor, are you in the
Yes.
agreement of this as well?
Yeah, no, I absolutely agree. I mean, I think that, even being scientists, we were not educated in the matter. We had never thought about fertility before we got married, and then it wasn't happening, right? So then actually a lot of my friends went through fertility issues, and some of them were not able to conceive. So, and I think that this is something that happened because also many of our scientists friends did not have this education in high school or early in university. It should be common knowledge, right? So I think that but sometimes people have the people that they get more educated, but they lack this, and it's a serious issue, also economic as well as emotional, and And you know, many of my friends, it didn't happen in the end because, again, it was too late. But yeah.
Yeah,
Yeah,
and I
thank
think
you.
that, you know, in this modern world, professionals tend to wait longer to get
Yeah.
pregnant. And and one of the things that would have been really useful information for us is that, you know, I think we all know with that with age there's a decrease in fertility. What we didn't know is that it gets to a point that where it kind of becomes a cliff, where after a certain age it's a precipitous drop in fertility. And that, you know, that threshold is slightly different for different women, but you have to be aware that at some point you're actually going to get there invariably. um, and,
Mm,
and having that knowledge will just trigger that light and say, you know, okay, yes, we want to wait, but we need to know, you know, how much to wait, what's reasonable to wait, you know, if and even if you decide to wait, um, you know, at least you know that there is a risk that you might hit that cliff if you wait too long. And so it wouldn't come as a complete surprise to you, which in a way it might help with the process if you at that point decide to go through IVF, because you said, well, I guess we knew that, you know, this could happen. um,
yeah,
but definitely having more information early on is key.
brilliant. And other than this, or other than that, is there anything else you wish you knew before starting fertility treatment?
See, one important thing, I mean, I think for us, for me, for instance, like, well, I guess in America you have to go through IUI before you do IVF. But to be honest, IUI, if it, you know, regular methods are not working, IUI, that's not necessarily going to work. So, you know, I wish we had just basically gone directly to IVF, because in my first IUI cycle, I had 5 eggs, which was the most I have ever been able to have. And, you
Mm,
know, maybe things would have been, again, like Igor mentioned, I think we were in that cliff, right? So we were basically in kind of like the kind of going off the cliff phase. And then after that, the yield was, I was not responding to the drugs. They had to give me less drugs to respond. So, but I wish I had known, okay, just go straight to IVF, do ICSI immediately, and just go through it. And maybe we wouldn't have had to do so many cycles. But, you know,
yeah, yeah.
again,
Melanie, could you
education.
quickly, oops, sorry, yeah, Melanie, could you quickly for the audience talk about the difference between what IUI and IVF are?
Yes, of course. So IUI, as we said, intrauterine insemination. And I agree with Barbara that not every patient, not it's not, even though it is considered as a less invasive treatment, it might not be the right type of treatment, depending on patient's age, or, you know, ovarian reserve. And it can, the success rate of IUI compared to IVF is much lower. So there are times, it, that's where we say that when we provide treatment, it is tailor made for you, because no one comes in that blanket category that you have to have IUI first before you can go to IVF, because it might not be the right treatment for you. In IUI, all we do, as I said, is less invasive. We take the partner sperm or a donor sperm, depending on what we're using, and inject it inside, up in through the cervix, up into the cavity of the womb, for it to reach, hoping that it'll reach the eggs through the fallopian tubes much easier, quicker. This is a concentrated wash sample. It can be beneficial for couples or who have had where the woman is not ovulating, so we can help the woman with ovulation and introduce the sperm at the right timings to help them conceiving. Or if there is slightly suboptimal sperm parameters, then the wash sperm can become better in strength, if I may say, or quality, and that might
Mhm.
help in conceiving for those people. But it's not, you know, it's not everyone's we say, cup of tea or everyone's treatment of choice. In cases, as Barbara is saying, I would completely agree with her. If we see that you are approaching the age where your ovarian reserve might decline quicker, or your quality of the eggs are going to become, get affected in the next 6 months, that's what we see statistically and everything, then IVF would be the right choice of treatment for you.
Yeah, thank you, Dr. Lee, for kind of explaining that to everybody. I just want to touch on Barbara. Earlier, you mentioned that a lot of your friends have had fertility treatment, and that also that a lot of your family haven't had fertility treatment. Were you kind of open with telling everybody that you were having treatment, and was it ever treated as something taboo, or that people made you feel you shouldn't tell or say about?
Yeah, so I think that it was for most people, it was considered a taboo. For our family, no, they were very supportive. But even though they were supportive, I don't think they understood, just because they had not been in our shoes, right? But they were very supportive. But for a few friends, most friends, it became a taboo, right? And it was a little bit funny to basically find them in the clinic in New York. Like, we would run into them, and some of them they have not even admitted they did it, but I know through other sources. So this taboo, it's a big problem, and it's part of the education. I think that we need to educate people, and we need to remove this taboo, because I think that one of the, I don't know, because I come from, my grandmother had lots of children, and basically the worth of a woman, you can traditionally, you have to be able to, give birth to children in a natural way if possible. And, this tradition of, so I think that there's a lot of stigma about whether if and I have to say this without crying, actually, because it's very emotional too, and I feel inside that all this kind of like, it's in our kind of like obligation as to be able to bear children, and to be able to, you wouldn't think of IVF, it has to be naturally conceived and all this. And again, we never thought about this. So yeah, so it's difficult.
No, thank you.
Yeah, I think this, of course, is a very, big societal issue, because it makes you, it makes the people who are having problems feel, inadequate, not up to par, if you will. It's not that people will tell you that directly, although maybe some of the older generations still do. But the people nowadays won't tell you to your face, oh, that it's just wrong that you're not able to do this. But some of them are thinking it. And it's really through no fault of their own, because that's how they, the environment in which they're brought up has basically placed those ideas in them. And I think this goes back to education. It's not just about educating people with facts about fertility issues and how to face those issues, but also it has to do with educating people in fertility problems are more common than you think. And B, there's absolutely not, I mean, it's almost, it almost sounds cliche to say it, but there's absolutely nothing wrong with having a problem with fertility. But if it's, if it sounds so natural and true, then why doesn't it happen more frequently? Why don't people just, assume that, of course, you have problems, that's natural. That's, that happens to a lot of people. And I think that through education, we can maybe improve that. And so, luckily for us, we don't have that problem, and so we're very open about it, and we tell everyone. And you know, to some extent, you know, we don't really care if other people think, oh, you know, you poor thing. It's like, well, you know, that's your, you know, opinion, and sure, you're entitled to it, but it doesn't affect us. And lucky for us, although we do have our share of friends who just flat out deny that they had the treatment when we know for a fact that they did. And again, we understand why they hide it, you know, but we also lucky that we have other friends who are like us and share it. And I think that this is important because you need that support. You need, you know, with the way most support groups work is you share your journey with someone who's gone through the same thing. And so if there wasn't this taboo, you would be able to more openly discuss, you know, oh, today I felt this way because this happened. And they would know exactly what you're talking about because they've done it.
Yeah.
We have some friends like that. You know, one of my friends, you know, when their child was born, one of the first pieces of clothing they got him, it said, you know, my first babysitter was an embryologist. You know, so they were proud of showing that, and I think that's great. You know,
That's cute. Yeah.
I have to
Oh, that's
say
really tickled me. Sorry.
that's Igor's best friend, right? So I guess they both together in this kind of emotional support. So.
That's great.
It was really interesting to kind of hear about how you felt as a couple, but especially Barbara, in terms of the expectations of women in society, and not to make this webinar a feminism and patriarchal argument, although arguably fertility health is feminism. It's quite interesting to hear that this is kind of reflective across a lot of women's health issues, and as scientists, you know, you'll be aware of that. And Dr. Malini, do you have anything to say kind of about this?
No, I think it is sadly the truth what Barbara and Igor are saying, that it is still considered as a taboo. People don't come out and they don't accept and talk to each other. Talking is kind of the biggest help you can do to yourself, actually, to share your experience, to share what you're going through, which can help you yourself when you're going through this, and the other couples who are going through this. So I agree with, you know, Barbara and Igor, that the more you share, the more it is come back to, again, educating, back to accepting, back to saying it's okay and it's fine if you have any issues, because it can be dealt with. It's nothing that you can't live with. You can be dealt with. We can do something about it. Then why can't we come out with it and say, like, you have any other problem, you know, you come and talk to people. Then this is the same thing, that you can come and talk to people, and society should be a bit more open about this. And hopefully going forward there will be more support groups, more education, more openness amongst people, to help each other, really.
Yeah. And then Barbara and Igor, after going through kind of what you've been through, and if you did have a friend who came to you, what advice would you give them when it comes to looking for a clinic or selecting their fertility doctor? What would you say that they should look out for?
I mean, I think that first of all, bedside manners, they were so important. I mean, something really like, even, you know, I mean, our clinic in New York was really good. City Fertility is really good. Something even not because, you know, some clinics have lots of pictures of babies in their office, and, you know, that used to break my heart. So, you know, just being very careful with the patients, because the patients are, you know, very fragile. So bedside manners is very important, and also that the doctors listen to the patients. And as Dr. Manili mentioned earlier in the webinar, that every woman is different, and this is something that in the at least a few of the clinics we talked to in London, they were not trying to accept. They had a standardized treatment and it was going to be like that with the same amount of drugs. And I was a non-responder to any of the drugs when I was in New York. My biology was completely different than what they were used to. So I think that we have to assume that every woman is different, and the doctors need to acknowledge that. And if you go with that, with the bedside manner and with the understanding of that every woman is different, then I think that would be the best advice. I don't know if Igor has
Yeah, I would agree completely with that. Bedside manner is really important, because especially if you've already tried it, try to do it somewhere else, and you're looking for a better clinic. You learn to appreciate bedside manner, um, because as already said multiple times, you're in a fragile state and you need to be told that things are going to be okay, number one. But number two, they need to explain to you why they think that things are going to be okay. And that actually also involves them listening to you and telling them your concerns and why you think certain things, or why you think you are not willing to try certain things but other things. And then having your doctor explain to you, well, okay, let's go, let's break it down. Okay, why are you afraid of this? And just go through the motions and say, okay, well, there have been studies to show you that this works and this doesn't work in these particular situations. I mean, thinking of the patient as a student rather than as a child, and explaining to them, with science, really, telling them, okay, this is why we think this is the best protocol. And going back to what one of the things that Barbara said is, one of the other telling things is, when they have established protocol, I mean, there are established protocols for IVF, right? There's like dozens of them.
Yeah.
And I think that one of the things that really convinced us with City Fertility is that the doctors are willing to tweak even the existing protocols to fit that patient's biology, that patient's particulars, and say, okay, now that we can use this protocol as a template, but I think there's a few things we could just modify, do minor modifications, because that would make sense for you. And not being afraid of that, as opposed to, with other clinics, one of the things that we had was, oh, these are the only protocols that are there for somebody like you. But, and it's just that, it's like, there's actually nobody like you, because every person is going to be just slightly different. And so these protocols, that's the way they should be treated. They are templates from which you start. And then, I'm telling you this as a scientist, because that's the way we work. And so for us, it makes sense that this is the way, things should be done in what we think of as a good clinic. And we saw that, at City. And that's the thing that I would ask people to look out for, hearing what the doctors are saying, making sure that when they're telling you things, they're explaining to you why they think this is the better choice, and even telling you why other protocols may not work as well, and then listening to you. So what are your thoughts? Do you agree with that? And never downplaying the patient's fears and concerns.
Yeah, definitely. And I think it's also important when selecting clinics that a lot of clinics do offer free mini consultations or open evenings. So when you're looking for a clinic, making sure that you do look out to attend those or to have a free consultation, because it's really, as you've said, important to have a relationship with the doctor and a mutual respect for each other. And you don't want to quite literally invest money into something and then wish you knew X, Y, Z a little bit later on. And thank you so much, everyone, for the questions been so invaluable. We do have a couple questions that people have submitted. If anyone watching does want to submit a question, please do feel free to write it in the chat box and we will try our best to get round to it. We have had a question from somebody and they have said, from the GP's point of view in the UK, couples try NHS IVF first. So by the time they're referred privately, they're already in their late 30s. Dr. Malini, would you be able to comment on this at all?
Yes, thank you for your question. And what I understand what you're saying, because by the time the patient has tried for, and according to what we have in our research and as taken as infertility, is that anybody under 35 should try for at least 1 full year unprotected regular intercourse, and anybody over 35 within 6 months, if they are not pregnant, try having regular unprotected intercourse, should seek some help. So I can understand if somebody who's tried for 1 whole year and then approach their GPs, and by the time they go through the normal routine checkups and some blood tests and everything, and have had referred to NHS with the waiting list, they come down. By the time they reach any private sector, they are in their late 30s. However, I would still say even in late 30s, there are things that we can do. They still have got an opportunity. There are things that can be worked out, again, based on their type of infertility. What is the cause? Is there any background issue that they are having, or is it just totally unexplained? But we can always plan a protocol that will be suitable for them and hopefully be able to help them. So they still have got opportunity, they still have got a chance, and they should, if they are not successful in the NHS cycle, come and approach us. Thank you.
Yeah, I think it's also important to mention that you can self-refer to private fertility services as well. You don't have to come through a GP, or after having gone through NHS treatment, you can come straight through. Thank you, Dr. Malini. Another question we've had in reads as follows. So I'm about to begin IVF treatment, but cannot stop thinking why it would work when I haven't been able to fall pregnant for 36 months. Barbara and Igor, is this anything that resonates with you at all?
Yeah, I mean, again, we tried for a long time in New York, and we tried for a long time here in London, and I think that the IVF process, and Dr. Malini, is the expert on this, but it's different than regular intercourse, right? So you, especially if you do ICSI, you're basically putting that sperm through the egg, and it's unless there's a big problem that those chromosomes are going to align, so it's going to be the embryo is going to start dividing, right? So I think that definitely even, and the other thing is that there's so many issues that we don't know about, like why is an embryo not implanting, right? So many tests, even like the uterine lining, that can have a problem, which I also had. I had everything. So basically you can actually go into an IVF clinic, you can learn what are the things that are wrong, that are preventing you from getting pregnant, right? So I mean, probably Dr. Malini can.
Yeah, no, correct, Barbara. As you said, trying naturally and having an IVF are different things. They are, when we're trying naturally, we don't know what is happening when the sperm goes in. Is it actually able to fertilize the egg? Has there been an ovulation? Has there been an egg release? Was the timing correct? Are the tubes open? There's lots of things that we don't know if we are assuming that all this is happening. Whereas in IVF, we take the egg out, we take the sperm, we see it if it is getting fertilized, and if there are any issues with the sperm, we can perform procedures like ICSI, where we will, under a microscope, embryologists select the most good-looking sperm and put it in the egg for the egg to be fertilized. and see the development and process of it and figure out what is happening, you know, and why it is happening. There are lots of times that we can't even know why things are happening, which is called totally unexplained. However, you're comparing apple and oranges to say if you have not feel IVF is the treatment for people who are not being able to get pregnant. That's why IVF came into existence. So if you are starting the journey, start with a positive attitude, and I would keep my fingers crossed that and I would say that it's worth trying, and hopefully you will have a successful treatment.
And
Thank you, Dr.
I just wanted to add that you know, perhaps this goes back to the issue about education, because you know, natural conception is actually an extremely inefficient process. I mean, it's so wonder that, you know, humans can actually get pregnant so, you know, so much, but it's, you know, from a physiological point of view, is an extremely inefficient process for all the reasons that Dr. Malini just mentioned. You know, the timing, you know, the hormone levels, I mean, just everything. And so to have some control over at least some of those variables, you know, that's why IVF is actually, you know, the way to go, because, and that's why there's an opportunity for that to work, even if you've been trying for that long, because with such an inefficient process, if anything is just mildly off, it's just going to make it, you know, nearly impossible. So if you can, you know, fix that or take control of that in, you know, with drugs or, you know, treatment, then, you know, that really gives you the opportunity to conceive.
Brilliant. Thank you, Igor. And thank you to our question asker. We wish you all the best in your IVF journey. We really do have our fingers crossed for you. Another question that we have just had in as well. It reads, I have low egg count. Is this going to be a problem? 2.5 is what they last recorded in August 2021. Dr. Malini, would you be able to answer this question, please?
Yeah, sure. Thank you for your question. Low AMH, well, low ovarian reserve is a problem. Possibly that's why you've not been able to successfully get pregnant naturally. I wouldn't say that it's a major problem in terms of the fact that I don't know what your age is, because age is a very, very relevant factor in fertility. So with the AMH of 2.5 and knowing where you are in your age group, that's where we can kind of somewhere predict what success rate we can expect for you. And however, as we've got, again, we're talking to someone here who's had multiple failed cycles and has had low egg count and has eventually been successful and successfully pregnant, delivered, and now very happy. It is about perseverance sometimes, because it is possible that the first cycle might not be successful for you, and we might even have to learn from how your body responds to the medication, to the protocol in your first cycle. We will tweak it as correctly Barbara and Ego just mentioned, that, you know, tweaking those little protocols to suit you and to adjust of how your body will respond the best can still give us outcome, a positive outcome.
Yeah, thank you, Dr. Malini.
If I might, thank you, Dr. Malini. And if I might add something, my AMH was 0.7. So, you know, was really, really low, almost negligible. So, I mean, I think that what saved me was that the eggs were really good when they were there. But I think that, you know, 2.5 for me, that's really good.
That's really good. So that's something that should make you feel really much better. And you know, but yes, another thing that's important is not to waste time.
Yeah, thank you, Dr. Malini.
Sorry.
Thank you, Barbara, and thank you for that question. Another interesting one we have here says, I am 36 years old and my husband is 41. we aren't ready to have children yet. Is it okay for us to wait a bit longer? Dr. Malini, what could you advise this couple in terms of waiting times, and then what to do if they're not ready, and other options?
So if you are 36 at the moment, the first thing first is I would advise both of you again to get your assessment done, to see where you are in your fertility status, and my advice would be having the knowledge that after 35, not only the fertility in quantity wise starts declining, but also quality of the eggs, which is very, very important. More after 37 and a lot more after 40. So what we have to be careful and mindful is, I don't know how long you are planning to postpone. First is to find out where your reserve is, where you sit in that fertility reserve. And based in that, if you're thinking of not trying for the next 4 years and try once you're 40, my advice would be to freeze some eggs or freeze some embryos. What you will get today as a result of this cycle will be much, much better than if you have to do the same things 4 years later. So this will be much better quality today. You might be able to freeze many more eggs or embryos, depending on, whatever you decide, or both even. And then you can take some time off and be ready whenever you are.
Yeah, brilliant. Thank you.
Yeah, if I may add something, if we had known, and again, we go back to the education, like Dr. Malini mentioned, right? So you need to know where you are, and we didn't. And in our case, I guess that's near when we started. But I think that time goes by, and once you find the cliff, then there's no way back. If I had known it, I would have tried as soon as I met Igor, but I think that we were not ready. We were postdocs, we were, in New York being scientists. I don't know, but I think that if I had known, right, if we had known, probably we would have done it. We would have not waited at all, but at least be educated on where you are in this process.
Yeah. Yeah, brilliant. And again, because we spoke a bit about having this education in high school, university, if, Barbara, you had been given this information in your early 20s or your late teens, do you think you would have considered something like freezing eggs?
Yeah, definitely. I would, yeah. And I will freeze them for my daughter if I can, if she, I mean, this is something that, parents that can do it, should definitely consider, because again, it's, and you don't always meet the right person or are ready at the right time, right? So I think that it's okay to have, because people are more educated, so it's important to be able to have the choice, but it has to be an educated choice. So.
That's true. I think, Barbara, I feel a lot of people will benefit from your experience, and it's so nice of you to come out here and share it, because just the fact right now what you just said, that having that education, just knowing about yourself is so important, and doing things at the right time is just so important. And these days we are ambitious women, we are ambitious couples, we want to do more than just starting family very early in life. Even somebody might want to just travel, or as you said, not find the right person in time because we're busy with work and everything. So just having that choice of having egg freezing or embryo freezing, or it just makes a lot of difference.
Thank you.
Yeah, thank you both. That was really, really useful. And I think we've definitely kind of explored some kind of repetitive themes today, which are knowledge, emotional support, and kind of fertility treatment as a holistic package. And I think those are the takeaway message, or the main takeaway messages for our viewers today. As I'd say, a massive thank you to Barbara and Igor for coming today and being so open with everybody and willing to share your story. It has been amazingly helpful, not only for me and Malini as people who work in fertility, knowing where we need to support our patients, but also for everybody watching today. So thank you so much.
No, thank you, Ella and Dr. Malini as well. Thank you. And I mean, we are extremely helpful to the clinic. I mean, to City Fertility. I mean, you believed in that 0.7 AMH. You believed in me, and you believed in us. And for us, it changed our lives. We couldn't be more thankful. And I think that, right, Igor? I mean,
the best way I can say it is that we felt the humanity in the clinic,
yeah.
and that's what you need most when you go through this.
Yeah.
And it was definitely there, and we're incredibly grateful.
Yeah.
Incredibly grateful.
No,
thank you so much. It's getting a bit choked up.
Yes, me too.
I know. It's very important for us as well. It's so very lovely to see you both and see you being so happy. And thank you for such a good feedback, and thank you for your time today.
Thank you, everyone.
Thank you.
Thank you.
Yes, and thank you, Dr. Malini, for coming and taking the time to share your amazing knowledge. I mean, I know how amazing you are. Barbara and Igor know how amazing you are. It's now great that we can tell everybody how great you are and the work that you help us do. So thank you so much.
Yeah.
Thank you. Thank you. Have a good evening.
Thank you, Dr. Malini.
All right, and thank you to everyone who came and viewed. Thank you for the questions. They were absolutely amazing. And please remember that you will be able to revisit this Q&A on YouTube. And if you could please submit us some feedback on how you felt the webinar went today, that would be brilliant. Hopefully, if you liked it, then maybe we can do some more going forward. Okay, thank you, everyone. Have a lovely night. Thank you.
Thank you, everyone.
Good night.
Bye.
Bye.
Bye.